A worrying new report on the health front. The Israeli population is facing an obesity epidemic. The National Program for Quality Indicators publishing a report today saying around 59% of the population in the 20 to 64 age group is overweight. Among Israelis over the age of 65, 40% of men and 30% of women are overweight too. Experts warning the obesity is leading to a chronic multi-systematic disease that must be treated professionally, since it leads to illnesses such as cardiovascular disease and mental and emotional problems. The other findings that raise concerns were those pointing to an increase in the number of smokers in Israel. So to make sense of all of this, we now welcome Professor Diane Levine, National Director of Health Promotion at the Clalit Health Services, joining us from Tel Aviv. Professor, thank you so much for your time. So these are concerning numbers when it comes to obesity. Are stress levels impacting the way we eat? What is the reason for these numbers?
Thanks for that important question. First, let's look at what we have now. We have data. We have to see this as a very positive move by the whole health service organizations and the Ministry of Health, who've come together, and we're able to have measures now that we can look at and follow trends regarding health of people in Israel. So this is a positive move. But what are we seeing? We're seeing that we're not getting better. It's not that we didn't know, and we don't know that the issues of healthy lifestyles should be a priority in our agenda, but it hasn't improved yet. So let's make sure that we understand why. Firstly, we're coming out of Corona, and we're still having to bounce back. Let's look at who we should be focusing on as well. Children, youth, many of them and many of their parents as well really have become so attached to screens and have been really the lifestyle that Corona has brought us has been detrimental. We also see that the issue of smoking, again, we have to look at the youth, we have to look at the children, and we have to see what example we're setting for them. We need all hands on deck. We need regulation that helps and enforce regulation to make sure that we're not exposing kids, particularly kids and youth, to tobacco products that we don't need them to be exposed to, and that we need to make sure that are not available to them. Also food products, and make sure that we're smoke-free homes. We want to make sure that we're also homes that are making healthy food available to kids. So firstly, we need regulation, we need enforcement, we need a national health plan that will help budget and help all the players, all the stakeholders to promote health in the families. And we need to have better messages to the families and to make sure that we're focusing on the families that really, really need the support for this. So we know what we need to do. We have to get back on track. We have to make sure that we're supporting this financially, professionally, and that everybody has a role, that we're also promoting this at all levels, on the national level, on the community level, and in the health services, and mainly on the family level. And let's not forget, we're also in the period of the World Cup right now. Right. So many families are watching together the sports. So sports is good, and we're happy to see physical activity, but let's make sure that we get up, move around, we have healthy snacks while we're watching the World Cup, and let's set an example for our kids and make sure that our families have health promoting policies. That's what we're looking for. And the data that you mentioned is really just indicative of the directions we have to go forward with. So this is what we're looking for.
You're raising so many issues that need to be tackled here when it comes to teaching children about food choices. But I want to pick up on one particular issue because it's really front and center for so many stories these days. Mental health issues are far more in focus. Emotional health, anxiety. Talk to us about particularly the youth. How do parents tackle this kind of situation, getting away from the screens, but also dealing with some things, some problems that they're not so comfortable discussing perhaps with their peers? What do you suggest? What advice do you share?
Well, thank you. That's a really important question. You're right. We've seen an increase of anxiety and mental health issues, mainly among children and youth. We're seeing it also in eating disorders. It's coming to the forefront in many different ways. So we're encouraging parents to listen, to see the signs that people need to be aware of mental issues, not to be afraid to talk about them, and to help kids get back into being in social situations. We know there's a tremendous amount of loneliness that families have experienced, but particularly youth. Those 2 years that kids were connecting only through screens with their classmates and with their friends. And then we have to get back into a social situation where there's social support, family support. And the health systems are really now understanding what needs to be done and are supporting as well. So don't be afraid to approach your healthcare system, to ask for help. And you'll see some creative solutions that are being made available to all families.
We so appreciate you sharing your insight. Professor Diane Levine, live from Tel Aviv. Thank you for your time.